All set? All right. Call the meeting to order. Before I accept the minutes, I had the chairman giggle at me. Oh, here you go. Well, I don't know if the administrator and the vice chair would like to lead us in a happy birthday for the chairman today or not.
So suffering for me.
I told you, keep laughing.
This is the best compliment I can give him. He is the oldest, but he doesn't look, doesn't. My age. Alrighty then.
All right.
I'll move him, Chairman.
You'll move them? Is there a second in the minutes? All in favor?
Aye.
Opposed? All right, very good. Veterans.
Morning, everyone.
Morning.
No, the peer updates were supposed to come from Jeremy this morning, but unfortunately he's unavailable, so I'm not quite as eloquent and cute as him, but I'm gonna try to deliver. All right, so for some Adirondack peer-to-peer updates, Jeremy's reporting that our female veteran participation has increased by 70%. So that's extremely encouraging. It's a kind of a target demographic that we've been wanting to increase. Peer-to-peer program has also started training sessions with VA instructors regarding PTSD and MST, just to better handle those unique circumstances. They're making progress further driving into northern parts of Washington County to make contacts with veterans who are largely isolated in those northern and southern tips of the county. And they've also began signing a lot of them up for home food delivery. It's a program that they've partnered with the American Legion post here on Pearl Street to start a meal delivery system through that. They continue to develop the communication and scheduling system with my office, providing transportation to veterans throughout Washington County. Increased our efficiency in that coverage and scheduling operations. Really pretty simply by utilizing shared calendars and scheduling a lot of riders through that. When we have a need for transportation, one party or the other kind of puts that up on the calendar, and the other party will kind of cover down and communicate that they have that transportation covered, or maybe we need to go look to alternative sources. We've also, tapped into LEAP quite often if need be. And, for individuals who are on Medicaid, there's other services that we can utilize as well at no cost. Continue to develop the relationships through businesses and nonprofits throughout Washington County so we can continue to serve the veterans better by utilizing their services again to try to minimize or completely negate any costs to the veteran. Peer-to-peer program continues to partnership with the American Legion and VFWs throughout Washington County. They've supported and supported events within the Greenwich VFW. I know my office has also partnered with them, and we've done quite a few tabling events at the Greenwich VFW with more and more veterans and spouses of veterans or close family members turning out to those events to get a lot of this information out to the masses. The peer-to-peer program is also looking to develop a relationship with the Whitehall American Legion post to kind of amplify that effect again going into the northern parts of the county itself. Some February events Jeremy wanted me to share that are coming up. They'll be going to Rockport in the month of February. They're also going to be doing go-karts in the mall and luxury box. They're trying to secure tubing at West Mountain, and he said he will be providing me updates for that. A calendar of events is going to be released here shortly as well. I wanted to touch on, I wanted to touch on, one kind of inquiry question I had, for the committee as far as the next committee, and if it would be to the benefit, for me to bring like some sort of presentation to really get into what my office does, what we provide for veterans, because I think there's this general veteran services that covers quite a lot, but when you get down to what my office actually does, I could literally spend hours up here telling everybody what we do, because it ranges from representing and advocating for veterans throughout federal claims processes, through the VA, to state benefits that New York State specifically offers, and provides to veterans, all the way to developing local benefits, within Washington County and within the villages within the county. So I don't know if that would be to everyone's benefit, or not, but I'd like to do that at some point.
We can work
I
that.
think that would be helpful,
Yeah.
especially for the new people.
Okay.
You know, we get a grip on that.
Okay, so I'll look to do something like that next month, and I'll try to keep it as short and sweet as possible, but for those that do have somewhat of an idea, again, I could sit up here for hours and bore everybody. Between now and then, if anybody has any questions or suggestions on what they would like me to discuss, then please feel free to email myself, and I'll make sure I'll cover it at the next meeting.
Anybody have any questions? Thank you for all that.
Thank you. Thank you.
Mental health is up there. Green arrow.
All right, so I'm Rob York, Director of Community Services, for anybody that doesn't know. Serve as the Director of Community Services for both Warren and Washington counties. And in terms of an overview, I would offer the same thing. I was planning on reaching out to new members to see if you wanted to set up something, virtual. We could do it like as a virtual meeting type of thing, but as Ken was suggesting, doing it in committee, so I guess I would ask the committee's preference if we would like an overview of our office, or would it be better to set up something just individually?
I think we need this. I've talked with Dwayne, and we're actually thinking that we could get different segments down there to come up and tell us what they do, because we don't understand everything that's done down there. So this may take us a couple of months to do a presentation,
Sure.
but certainly we can get them all scheduled. Yep.
All right, I'll wait to hear of it. Okay, my first item is a resolution request to amend the 2026 Washington County budget. This is to carry forward some unexpended opioid settlement regional abatement funds. And this is in the amount of $645,754.
Motion closed. Motion I stand. Second. Any discussion? We can't move this over to the mental health bill. Can we?
I was thinking the same thing.
All in favor?
Aye.
That'd be moving it to finance.
Now, I did have a couple of other items that came up since I submitted my materials, so I'm gonna ask if it would be acceptable to present these. Did I send enough around?
We need some more down to the committees there.
I'm sorry, there we go.
Yeah, there's some.
They're the same, okay, send one, yeah. Or did you get it? Okay.
Yeah,
Okay.
we have it.
So this is a two-sider. So the first side, I will go with the request to amend the 2026 Washington County budget for acceptance and pass-through funding in the amount of $50,657. The New York State Office of Addiction Services and Supports. 100% state aid that's designated for one outpatient.
The motion Senate Finance, got it? Second, Ian, questions? All in favor?
Aye.
Oh,
And on the reverse is another request to amend the 2026 Washington County budget. This is all acceptance and 100% state aid from the New York State Office of Mental Health in number 339,926. And this is designated to help offset county costs related to our assisted outpatient treatment. Make the motion.
you have a motion, second? Second. Outpatient. Is that a general? I mean, I'm looking again at the top
Yeah.
that we have a health outpatients, and it can't be applied towards that, can it? No, okay, I had to ask. All right, all in favor?
Aye.
Opposed? Right,
All right, and then another item, I guess I'm gonna ask for some guidance again, committee. In 2025, we received $6,262 from New York State Oasis that was designated for the purchase of two medications for inmates in the Washington County Jail, naltrexone and buprenorphine. These are medications used to treat addiction. And I did bring that to committee, recognized it in my 25 budget. I thought there was a request to develop an MOU, but I could never find a board resolution for that. So one question would be, I think the committee approved that. Does the development of an MOU need full board approval, or is it that like something that was, since it was approved by the committee, that was sufficient?
An MOU with the jail, you're asking?
With the sheriff's office to pay for these medications. It's really reimbursing the sheriff's office. They've already paid for the medications, of course. So,
I don't think you need an MOU.
Not for drug reimbursement, you should be fine.
okay,
The
so,
only thing you need an MOU for is that RFP that he did for the services that were applied for through the opioid funds.
right,
That would require an MOU. This drug reimbursement doesn't.
does it. So by recognizing it in the budget, I just need to submit payment voucher with the
Yeah.
backup documentation.
Yeah.
Good, okay. Very good. Thank you for that. And that was it.
any other questions, Ron?
Right, I do apologize because I have to run through another meetings. Thank you. Thank
Be
you.
safe. No running in the halls.
Hello?
Morning. Oh,
Right. My fingers aren't working yet, I apologize. Myself, and I think that ought to do it, hopefully. Good morning, I'm Shelley Smith, I'm Executive Director at LEAP, and I'm here to report to you today on our contracts with Washington County. Two different contracts, so as I recognize there are a couple of new people in the room. I won't take too much time, but I'll give you a brief overview. So LEAP is a private, not-for-profit. We are Washington County's Head Start, Community Action, and Workforce Development Agency. We have buildings, or we have, we're spread around the county as far as Head Start. We have 5 different Head Start locations, both community services or emergency services, community action. and workforce development are housed in this building, in the basement. Within emergency services, we have a food pantry, which is also housed on the Washington County campus. And that is one of our contracts. Washington County subsidizes that food pantry. $40,000 a year has been the last couple of years. We just renewed that contract, and so that is why I come to report to you on that, to let you know what our pantry is doing, so you know how the money is being spent effectively. And the second one is a contract with the Office of Aging for senior transportation in Washington County. We transport, and there's an overview here in the report, but we transport seniors to medical appointments and other social engagements and other things that help them sustain an independent as independent a lifestyle as they can. We do prioritize medical appointments. And when I say that, I mean, if all of our drivers are busy and someone's scheduled to go to a haircut appointment and someone else calls and needs to get to a medical appointment, the haircut will get bumped. But other than that, we don't discriminate in any way as far as what kind of appointments they need to get to. So I report on those numbers here as well, and those reports also go to the Office of the Aging. Did you get yours this year, this time?
I do typically receive monthly reports. I did receive one, I'm sure.
Oh, this is just that rolled up. No problem. Okay, so, first, and also I'm going to apologize in advance. I do also generally provide an actual financial report for you, and I don't have that today. My finance director has been out unexpectedly for a few days. So she normally would provide that for me before I come in to see you, and she just has not been available to do so. I'm happy to send it to the committee after the fact. She's back today and working on it, but just couldn't quite get it done before I had to come in. So I'm happy to send that to you after the fact, and I will do that. So I'm sorry.
One question on the consumer serve, October is 119, and the other 2 months dropped off, less than half. Is there any reason for that spike in October that you know of?
When you get.
Oh, on transportation?
Yes.
No, I don't know actually what the drop is. I can find out. I can ask our transportation director if she knows what the.
And I mean, and we had the
Trips are consistent.
same thing in December on the food pantry. I was surprised, yeah. I wondered what the reasoning was. More people invited over to their families.
Yeah, I would've thought that number was great.
Food pantry, I think I can address more
Okay.
directly.
Shut down?
Yeah, most likely. So, if we start with transportation, the one-way trips also did decrease, and we had new consumers decrease as well as the overall consumers served in November and December. I am not sure what drove that drop, but I am glad to talk with the transportation coordinator and see what I can find out. I know they've been busy. Well, I can say partly in December, we do have an agency who shut down for the holidays for 2 weeks. But that would have only been the end of December. It would have been 1 week, week and a half in December. I think 22nd was when we shut down. And that would not account for November. So that's just speculation. That's not a direct answer, but I'm happy to find out. So I made a note of that. I will find out what I can. If she has any insight into why the drop. Yeah. And then as we look at the food pantry data. Our December number of households served did go down significantly. This one, I am reasonably confident is a data problem. So also with this data, and I am full of apologies today. And I'm happy to do an additional report between, I usually do this quarterly, but I'm happy to do an additional one if anybody wants me to do that. When I say this is a data problem, we have changed to a new data management system, which is more robust and is really, I'm very, very happy with it. That said, we made the actual transition to using that system solely at the end of October. And we had some hands-on training with the system. Right here, had them come here in the building and work with us for 2 days just last week. And we found out some very significant things that we're doing wrong. The data's going in, but it wasn't going in the right places. So when I pulled reports, I'm not getting all the information that I should. It's in there. So that's the stuff that I would normally refer to that I'm not able to get, wasn't able to get this time is like demographics. What percentage of federal poverty level are the people that we're serving food pantry? And how many new, that was the number that that's the number I also usually report to you for the food pantry is how many new clients we saw. Again, we have that in the system. It's as simple as one thing that has not been checked off in most profiles, but it's taking some time and our technology is coordinated on that, but it's taking some time to fix. So since we just found it last week, I couldn't get those numbers for today. But these are the raw numbers that are households served. And I think 67 in December is low. I don't think it's accurate. I've got to be honest. I do not think that's an accurate number, and I don't know why. And I'm going to have to dig into the data once it's fixed and try to figure that out.
I just realized you said that you weren't getting the demographics.
Yeah.
So when people come through the door, do you have them fill out a sheet so that they have an idea? I mean, this is some of the things that we don't understand
Right.
that go on in some of these things.
Yeah.
Do they fill out a sheet so we have a profile of the people coming through the door? Is that what you're saying? Or-
Yes, we do. We do collect all that demographic data. Because we are a community action agency it's CSBG funded, for our CSBG funding, we can only serve people at 200% or less of the federal poverty level. We do still serve people. If they come in with a need for the pantry, we're going to serve them, whether or not it's 200% of the federal poverty level. But we do have to keep track of that, and we do. Previously, it was all on paper and then various spreadsheets. Now it's all going into that system, and all of that demographic information is being counted. So we have all of it and it's all entered. It really is a simple thing. Anyway, we do track that, and I'll be able to continue to report on that.
Is that something, not every month, but like at least once in a while, the committee would like to see?
I have a whole background for Comfort Foods and Greenwich Hygiene.
Okay.
So, yeah, but useful because every organization is different. I know Comfort Foods, if you walk in the door, you're considered needed it, so that, but they don't have the same restraints as you do. So, yeah, I'd be happy to hear that. Question of individuals served, said how many people came through the door or how many people are in those households?
That is the households expanded.
So it's like 5 people times.
Yeah.
Thanks.
Yeah. Households expanded is what individuals served is. And as I said, the demographics we usually have are primarily federal poverty level, but we do also track the homeless community usually and in other general demographics as people are willing to disclose that information. We don't insist upon it beyond what our funding requires. We have seen some great changes in the past couple of months. With the government shutdown in October, we did perform a couple of layoffs and furloughs, which affected not the transportation program, but it did affect the food pantry, it affected emergency services. We did not put any restraints on the food pantry program when we did those layoffs. So we've actually seen some really cool increases, not necessarily in traffic, but in things like, for instance, we were getting very, very small amounts of food from our community partners. Like we glean from, Comfort Foods, that hasn't changed, but Market 32, and we were getting very small amounts of food from them. In December, we got we got 500 pounds of meat in one meeting opportunity. We filled every freezer in the pantry. And that's something we hadn't seen for a long time. So we've been working very hard to improve those relationships and to do what we need to do with those, with those kind of things to increase the efficiency and the function and what of the food pantry and the number of people that we can serve effectively, not just, I mean, we serve effectively, but serve with enough, right? Give them the choice that they need. We've also moved our coat closet to the food pantry. We do give away coats. That's something I don't report on here because it's not a contractual thing, but we do that. And have changed our food pantry over to a choice food pantries. And we used to fill boxes and give people a box, and now people can actually shop for themselves, and they're doing that with a guide so that there's someone that can help them make good choices, but stay within the regional food bank guidelines.
They have questions. Thank you very much.
You're welcome. I will send the financial data to you, and I will get the answer from the transportation numbers as well. Send that along. Thank you.
Morning.
Good morning. I'm Sue Maury, for those that don't know me. I'm the director of the Youth Bureau and Alternative Sentencing. So I sit for the Youth Bureau. Anything youth related, I bring to this committee, generally speaking. Anything alternative sentencing, I bring to Public Safety Committee. So you'll see me twice. And then I did want to say that LEAP, we work closely with LEAP on a couple different things. They use an office space and they facilitate the teaching of GED classes. So they use one of our conference rooms for the classroom setting on Tuesdays and Thursdays. And then they also are a work site for us for those who might have maybe some physical difficult to place community service folks that have to have court order community service completed. So we work pretty closely with LEAP also, and they are in the basement, so we see them often. But as to my agenda items, the first item is our resource allocation plan, and I'll pass these out. Some of you have already seen these because I do bring these to committee because part of the resource allocation plan is I need to, it first gets approved by our youth advisory board, and then I bring it to committee for approval. And in the past, I've then brought it back to committee once the state approves our resource allocation plan. And these are for youth development program funding, youth sports and education opportunity funding, youth team sports funding, and runaway homeless youth funding. And that those all funnels through the Youth Bureau and go out to the programs as listed in those charts. And then some of them are contracts over that $5,000, which in the past, I brought that to committee to get permission to contract with those that are over the 5,000 per county policy. There's always been a little bit of discussion as to whether I need to come back to committee because you do approve my submission of the resource allocation plan, but here I am. So the programs or the funding I highlighted, hopefully it showed up. All those that are over the $5,000 limit. And the YDP funds are generally those that go directly to your town and village recreation programs to support those programs. And along with some of the community programs, we have been told by our state association that we expect, or they expect that to be kind of level funding for next year. And then along with level funding for runaway and homeless youth and youth sports education and opportunity funding, youth team sports funding, is, that's a legislative ad, so they don't know that there will be any funding under that category. And for this year, there was also an initiative called New York Kicks that is funding is specifically for soccer programs. And to be determined whether the state will, whether the Youth Bureau will be the agency that will monitor that type of way.
So didn't you forward this to us?
Yeah.
Yes, we got. it.
Yeah, so
This-
you
this is
have-
The same as what.
Yeah,
we
this is
forwarded.
the
Gotcha.
exact same thing. It's just the highlighted for those that are over that $5,000 mark. That by policy, I have to bring to committee for me to contract for our agency to contract with. them. Or at least in the past, I've always done. it.
You asked
Move
for
it.
I'm asking for,
approval.
I'm asking for approval to contract with them.
They moved it.
You can make a committee, we have to move that somewhere else, or can we approve it?
I think the committee.
I think in the past, the committee. has-
Yes.
Second.
Second, yeah. Discussion.
These are all pre-approved budget items. It's all on the,
Yes, it's all in our budget.
and you just divided it up in there.
Yes, yes, yes. And at any time, glad to talk to you about all of the youth funding sources.
Just one quick question.
Yep.
What's the ladder up to success?
So the latter, so that's the Youth Bureau initiative that got approved, and that is, we are developing, or actually have already initiated an idea that we will have youth, so these are funds that we keep in-house for the Youth Bureau. So we want to get more youth involved, so we have an application that has been sent to all the schools for a subcommittee kind of concept of the Youth Advisory Board that will meet once or twice a month to kind of, it will help us a couple different ways. On all of our state plans, there's a needs component, so we're hoping the youth that are involved on the subcommittee of the Youth Advisory Board will develop kind of a needs survey that will go out to kids and that we can include that information into the plan. So it's really about a leadership program. And then based on their commitment to the subcommittee, they then would be recommended to be a full youth on the Youth Advisory Board, and or there's a bang for the buck. It looks good on their resumes. We can help them with all of those pieces for college and those types of things. So the ladder up to success, we have sent information out to all of the schools, and we already have, I think, a couple youth that are interested in being part of like the subcommittee concept. So, and it's really not just about the youth that traditionally, you know, your National Honor Society youth, glad to have them, but it's really about reaching those kids that aren't in sports, or it gives them something that they can be part of. So that's the ladder up to success, and it got approved by the state to have this program.
Any other questions, discussion? All in favor of the motion to approve the pending? Aye.
Aye.
Opposed?
Thank you. And then on that note, I do have some reappointments and appointments to the Youth Advisory Board for a 3-year term. And those would be a reappointment of Anthony Jordan and Katie Paddock. And then to appoint Lisa Carpenter from Fort Edward and Corey Burton from Hudson Falls. And Lisa is involved in the Fort Edward Rec program, and Corey Burton is works at Hudson Falls School District, but also is involved in the Kingsbury Rec program. Both of those, all 4 of these people are adults. So currently we have 3 youth that also sit on the Youth Advisory Board.
This motion go full board. Is there a movement? Moved by Chad, second. Any discussion? All in favor, aye?
Aye.
Thank you. And the third item, I don't believe I need. I originally thought that our Warren County contracts with us to provide Youth Bureau operational services for Warren County. We originally did not put it in our budget because we did not have a signed contract. Thanks to Dan, for helping out with that. We finally have a signed Warren County contract. That's official. It was a process. Let's just say that. It was a process. So I do not need any action item for that, I don't believe. However, the youth intern backfill request is related to the Warren County contract. We do have this position, a youth intern in our staffing pattern, but it was always just contingent on the Warren County contract. So I would ask permission to backfill a youth intern position. And that's for up to not more than 20 hours per week. It's considered part-time. I can say at a rate of $20.32 an hour. I can say that it's a position that we always expect to have a bit of a gap and probably never actually spend the yearly amount that's budgeted of $21,132, only because like this time was a gap in having the signed contract, and sometimes we're expecting that they may have conflicts with their schedules. So the youth intern we utilize to do some transportation, meet with some youth that we can't get to in the Warren County, supervised community restoration, answer phones. We are with the budget. We did decrease the staffing by one full-time person, and then the part-time person that supervises our STSJP youth employment in the summer months. So we expect that the youth intern would provide some of that supervision for those youth employment program and some of those things.
Was this job filled in 25?
So we had somebody, it was perfect timing. We had somebody in 2025 and she gave notice that her schedule was changing. She gave notice at the end of September. The contract was supposed to be signed by October, so we just waited and did not fill, knowing that I needed the signed contract. And then, of course, it took forever. So we did have that position filled last year, or for most of the year. And it was definitely helpful. And then, of course, you're generally speaking, it's a college youth that hopefully will potentially know about the jobs in the county also. So could it long-term help with a little bit of recruitment for different agencies as they become
Is
familiar?
that money earmarked for that job? Is that the only thing you need it for? Or
So we do, with our actual contract with Warren County, we do not have it. We didn't add that we have to have a youth intern for that. It's just that when we knew that we were contracting or potentially going to contract with Warren County, it was an ask and then added to our staffing pattern. So they could do other tasks because it's not directly funded, although I would not hire if we did not have the Warren County contract, if that makes sense to you.
Go ahead, Sam.
Yeah, so that's already included in the 26 budget.
Yes, yeah, it's not a new intern position in our staffing pattern.
And I guess,
Go ahead, Sam.
just my other question, Chairman, I thought we had done a motion at the backfills. If there was one there, which is a matter of bringing it here for approval. It wasn't
The personnel.
the personnel rather for approvals. I think we just decided that last
And I-
meeting, I think it was.
I have discussed this with Danielle, so she's aware.
So it'll come to the personnel.
Right.
committee then.
Yeah.
So this, if we move it, it'll go to personnel.
Yep.
My question is, does this position sunset with the contract? I mean,
Yeah.
And so it's a, okay.
So,
It's not permanent, it sunsets with the contract, it's,
right,
comes up
which is
again.
why I had not hired.
Yeah.
Waiting for that actual contract to be approved.
And one of
So,
the things that
that
happen with the
makes-
contract, usually it's a year to year.
Yep.
And then Warren County, the passage resolution. October 1 of last year to December 31.
Right.
Of this year, so we figured it made sense to just do a 15-month contract as opposed to doing a 3-month, then another 12-month after. Or 12-month and a 3-month, as the case may be.
And then next year's contract would be a 9-month contract. It was a challenge. Let's just say I started the process in August.
Make a motion, move this to personnel.
Second. Second from Sam, any discussion? All in favor, aye? Opposed?
And I think that's all I have. If anybody has any other questions.
Anybody have questions for Sue on anything? Thank you. You're getting an extra chair. Yep.
Be a gentleman. Don't take that one.
We told him you might not be here and we might not need you. Take care.
So now I have to say no to everything?
No problem. Good morning. You two would introduce yourselves and then you can jump right into your thing.
Good morning, I'm Gina Kentucci Mitchell, and I'm the Director for Office for Aging. I'm here with Rebecca Palmer today to talk about a specific resolution that we are putting forward to committee. So please call me Becky Palmer, the accounting supervisor for the Department of Social Services and Office for the Aging. And Dwayne would normally be here to talk with you folks, but he is at our winter conference for the New York Public Welfare Association. Which that means that item 2, he's hoping that we can defer that to the February meeting so that he's here to present any data or statistical information that he can make available to you and to be able to answer questions. And item A is a joint effort between DSS and OFA, and that's something that we're gonna move to after I'm done with the 2 DSS resolutions. So if you look at B, which is for the shelter arrears eviction forestallment program. It's a program through the state Office of Temporary and Disability Assistance. It's 100% state funding. They are providing us with an additional $34,000 for a program that will carry us through the end of September. It's about the same amount of money that we received in 2024 into 2025. And we were able to use it for what it's intended, which is forestall evictions for 6 families. And I would assume, depending upon the amount of their arrears, that we will be able to do at least that again. And 100% revenue is associated with those expenditures.
So Becky, I just have a question. So they go, let's say it's 6 months under rear. What assurances do we have at that point in time that you're gonna keep up to date after that, or did they come back to the well?
That's a good question. That would be one for the program folks. That's something that we can look into, then we'll get back to you on.
Point Sam, that's just one of those things that we need to learn better, what was that? Does anybody want to move?
Well, finance.
There's such everybody saying. Any more discussion, questions on it? All in favor, aye? Oh, okay.
Okay, and item 1C is another budget amendment. For those of you that were on the same committee last year, you may remember that
we receive a bill once a year. And it is usually 12 to 13 months following the service period for youth that are placed by a judge in an OCFS, that's Office of the Children and Family Services, in an OCFS facility. It happens that for 2024, we had a youth in that particular type of placement that the bill came in just a few weeks ago at the amount of $203,647. The actual bill is about $407,000, but the state removes their 50% before they send us the balance. We also don't have, we're not going to be issuing a check for this. Instead, what they do is it's gonna be a deduction from a state aid payment that would be otherwise coming to us. As I said, the reimbursement, we've already basically received that. And so whatever we have to pay out at this moment is considered 100% local share. We have additional funds in our family assistance. This is a 2025 item. We have additional funds in family assistance. That money would have had some money associated with it for revenue had it been spent on family assistance. But obviously, making this change will amend the budget.
Sure. So, and this is not aimed at you, it's just a question in general. So if in essence, the state's already gonna take it out and we have no choice in it, why do we need to approve it? I mean, I don't know.
You know
I'm just
where
asking.
This is to amend the budget, Mr. Hall. We're gonna overdraft your account.
Okay, so we need to do this just so we can amend the budget.
Yes, sir.
Okay.
I know there's one line missing, just for the whoever's drafting the resolution. On the revenue code, you're gonna need to, that decrease in revenue will have to be replaced by appropriate fund balance to balance it out.
Okay.
We know what, when they're not sending us, do you know what? Is it just out of the general chunk or is there specific programs that they're not gonna reimburse us for to collect their money?
I would say that it's for OCFS programs. So those would be the child welfare programs.
Mr. Chairman.
Well, this is a program question that you might not know, but is this kid still in there?
No,
No.
you may be going back in, but as of right now, no.
Okay.
Thank you.
So Dan, I have a question now for you. Is this person, youth, that if we had a joint youth detention center with Warren County, that we could keep him there, or would he have to be in a special?
I believe this was a secure detention.
It's secure detention.
So if we could keep him there and we could have a 15-bed setup with what we could save already 400, well, 200,000, but 400,000. And we do have other individuals that go in and out of these, especially ones that are in the system.
You're right now, the vast majority of them are coming through the adult, or excuse me, the adolescent offender, which the DA's office generally has control over.
I only bring this up because we have a lot of our programs in here overlap with what happens on the other side. And I don't know, if Sue was in on this discussion, but the state's claiming, oh, there's money out there for the raise the age that's not being utilized. And if our Essex and Warren and us could get together, our sheriffs, and utilize some of that money to put in a facility and we all contract together, maybe we could save a bunch of money on one end and we wouldn't be transporting kids to Rockland County or to Buffalo or wherever else and then trucking them back for
The chances of getting approval, given OCFS's current position, not very good. Even if we have everything planned, the trend over the last few years is to, I mean, they've closed several detention facilities over the past few years.
So on one hand, they're telling us there's money there we ought to be using, but they're not gonna let us use
Possibly.
it.
Insert shock space here.
And how old are the, like this child here, how old are
This particular youth was 17, he was 16. While he was there, he had multiple charges in this county, he had multiple charges in Warren County. And this, and obviously I have to keep names and whatnot confidential, but this was a youth we identified pretty early. We tried putting every service in place ahead of time while, you know, I initially filed one petition against him. I filed two more because he kept breaking into local businesses. I did the same thing in Warren County and his behavior escalated. It's very rare. It was very rare when the former commissioner would say, oh, would agree to OCFS, but this was when we literally had no other options.
Thank you.
So why are we paying not more?
Because unfortunately, we went first.
Their motion to. move-
And the way unfortunately, Warren County is very good at this. With juvenile delinquency matters, fact finding occurs where the crime is committed. Disposition usually occurs where the youth resides. And Warren County has been extremely good on any children who happen to be Washington County residents, sending their dispositions over to our court in a fairly quick manner.
Reciprocated with that.
Well, I've been trying.
A motion to move this to finance. Is there a second? Any more discussion on it? All in favor? Aye. Opposed? Said it. Do you have anything else?
So the reason why I'm for you now is because of the next resolution, which is on the agenda. To give you some background for those that aren't aware, several years ago, back in 2007, there was a state initiated program and it was called New York Connects. And so New York Connects inspired Office for Aging and Department of Social Services to develop an MOU and create a program that we call One Stop Shop, single point of access for services. And so I'm honored to say that Samuel Hall here has been through that back in 2007 and has great knowledge around the history of the evolution between both departments. So when that did happen, at the time, the Commissioner of Social Services and the Director of Office for Aging developed a budget. And the budget has been in existence since 2007. It was really highlighted this past budget year in terms of really I want to say the co-location of allocations and such and the appropriations. So during the fall, during the budget process, Office for Aging and the Department of Social Services were asked to divide out the appropriation line. And that is what we're talking about now, is the submission of a resolution to transfer the Office for Aging administrative funds from the DSS appropriation lines and develop its own set of budget.
I'll let the treasurer go first.
I would just remind the committee that during budget time, it was a request of myself and the budget officer for this to happen. We don't want to change the structure of the performance of service. What we want is a better tracking of the net cost of each department, especially with the current budget crises that we are facing. It's more and more important to be able to track. Net cost is really the way that we track the impact on the taxpayers. So being able to better track the net cost specific to ADRC and the net cost specific to the Office of Social Services is beneficial to you all in making your decisions on how we execute those services. That's just a little background of why the change.
I'll move it.
Okay, unanimous second. Discussion. This, Deb goes to finance first. would it?
Yes.
Yes.
Okay. This is the finance. All in favor, aye?
Aye.
Opposed?
Thank you all. Thank you, Gina and Becky.
Thank you.
Yep.
So at this time, I'd like to move into the Office for Aging agenda items. Like to start by passing around our one-page summary of services and like Ken has mentioned, each of these items are really very shortened, generic topics that our office provides. I have been known to speak for hours about the programs and services that our department provides. I'll spare you of that now and give you the one-page synopsis of what we do. And so as I spoke earlier, Office for Aging does have an MOU with the Department of Social Services, which allows for the co-location of certain services that would typically fall under DSS. And just to highlight one of those services, Adult Protective Services, that does fall under the jurisdiction of DSS, but with our MOU, Office for Aging, the Aging and Disability Resource Center does take supervision over that program. So I would like to request that you could make copies of this, and you can hand it out to your constituents. You can post it on your website, on your social media pages. And certainly what we always share with folks is that especially for new committee members, don't expect to know everything from each department, but certainly reach out and just send people our way. We would be gladly able to assist you and support with several questions that you may come across. I also like to share that we do have our website, and on our website is a true description of these programs, more detailed description of what we offer. To highlight past annual reports, which really dig deep into data and into the definition of the programs and services that we offer. We also do a Facebook page, and we're known for, through our New York Connects program, for highlighting programs, particularly in other departments as well.
Anybody questions, comments?
Oh, Chris, the age group here, what's the goal?
Sure. So it's a great question. We're asked that several times. So just to give you a little synopsis, so Office for Aging and the Disability Resource Center, the MOU creates the ADRC. So you're going to hear us called Office for Aging. You're going to hear us being called the Aging and Disability Resource Center, ADRC. When I spoke about New York Connects, that program serves all ages and all populations. So, so we're not just serving older adults. So I wanted to preface that. So with the Office for Aging programs in here, when it does speak about serving older adults with items like our home care services, the federal definition of older adult is 60 years of age and older. And so we do go by the Older Americans Act, which is through the federal government, and that gives the true definition of older adult.
Any other questions? I just want to say that, you know, a lot of these programs would, especially with their aging community, can really help out some of the older adults, sort things out and get things figured out. I guess kind of in my mind, maybe it's not anybody else's. I'm trying to think all the budget stuff we just came off from. Like on this list of stuff. Could we, I don't know if we have stars, or some of this stuff must be partially federally funded or state funded, or is it You're talking about?
No, so we have multiple funding sources and they are federal and state and of course supported through some are supported by county funds. So each funding source, and I'm just gonna throw out an estimate, we probably have about 15 to 20 different funding sources. And each funding source, whether it's state or whether it's federal, comes with its own rules and regulations to include local match requirements. We have some programs, some funding sources that require a 10% local match, and we have others that require 25 or higher. And that goes along with the state funding sources as well. And so again, how we distribute it is really based on the rules to each funding definition. So yes, the one service on the sheet that was county funded was our restaurant dining program. And so another reason why I'm handing the sheet out today is because we did update this sheet. As some of you know, in the funding period, in budget negotiations, the restaurant dining program was county funded, and it was a program that we like to say that we're putting on pause until, you know, we're in better financial standing, and then look to revisit that, so.
Yeah, my question was, are there any of these programs that are jointly funded between the state and the feds, or are they all separately?
Yes, so the funding sources, some of them are interchangeable, like we do have to get into all the lingo, but we have like a 3B funding source, that is very similar, that's a federal funding source, Title 3B. And it's very similar to the state funding source of CSE, Community Services for the Elderly. And so, what we like to do is use a little bit of both to be able to support that program, and in a way that it's more efficient and economically beneficial to the county to provide the service and to keep the cost low.
Thank you.
And these questions just confirm the importance of the segregation of the financials. Because with the account structures changing, you'll actually be able to see on a fiscal report how her revenues lay out against her expenses, right? You'll see these 3B, you'll see the RAP, you'll see the HAIP, you'll see all her different programs or HICAP, excuse me, I misspoke. So you'll be able to see those in her structure against her expenses. So I think there will be a benefit once we get there.
Can you send this out electronically?
Yes,
Appreciate it.
And you said it is on the county web as well.
correct. It is on, we did make it a PDF downloadable document, so it
There
is
you
on
go.
the website if you'd like that.
Any other questions on the sheet? Okay.
With that said, most certainly, anybody is welcome to come into the Office for Aging if you wanna come down and meet with me, meet with my staff. You're more than welcome to. Next month in February, I will be highlighting our annual event called March for Meals, and that is when I extend an invitation for everyone to come and really get a deep look into our nutrition program and how our nutrition program is more than just a meal served, that it's truly a wellness program for our older adults. So,
Thank you for all you do for our senior citizens, everybody out there. Are in desperate need. Yep, thank
like
you.
I've told many, I think I have the best job ever. Yes, I love being an advocate, particularly at the Albany and federal level, and speaking about the needs of older adults and the absolute importance of Office for Aging and how we really truly enable folks to stay in their communities and be supported while living in their homes. And that's coming out in the governor's.
They do the appointments.
Yes, I do. So the next agenda item is you're required to have an Office for Aging Advisory Council. This is the time where we look to appoint and reappoint members. And so I have provided a list here. These are all individuals that several supervisors are aware of. We've reached out to these individuals and they've all agreed to serve for the next 2-year calendar year period. I'm very excited about this group of individuals. There is a lot of diversity with these folks, which I think is gonna bring a lot to the table when it comes about speaking about programs.
Is there a motion to move this list to the board? Moved by Scott. Second by Ms. Bird. Any questions? All in favor, aye? Opposed?
Thank you. There are still some open spots where we don't have people appointed. We can look to appoint those vacancies at any time, and I believe at this time we have one more at-large position still available, which doesn't necessarily have to be appointed from a town supervisor, but can be somebody that somebody recommends that that supports special population that we would like to.
You'd like a name now,
Sure.
Barbara Price from Greenwich.
Yes, Barbara and I have worked together for about 15 years. She's amazing. She is a true leader when it comes to caregiver services, and her and I have had several conversations. Her time is stretched thin. I certainly will, I'll speak to her about it again.
Helping her stretch her time.
Exactly. Thank you so much.
Thank you.
I want to nominate you, right? Oh, I.
Is that your birthday wish? Final answer?
Morning, everyone.
Morning.
I'm Tina McDougall, Public Health Director. And again, I offer the same. If you would like to stop in and see me, schedule a time to meet with me, go over our programs. I did bring a couple copies of our executive summary from our annual report from 2024. So I can give those to you after. And they're also on our website with the full report as well. So the first thing I have on the agenda, I do have a couple resolution requests. It's that time of year where we like to pull over our a couple of our grants into the 2026 budget. The first one is the Child Passenger Safety Grant, and the amount of $11,500. So that is unspent money that we'd like to pull over into 2026 for that grant year.
Good finance, second by Scott. All in favor?
Aye.
Oh, you're okay.
Okay.
I have, after you the vote.
Aye.
I
Okay.
just wanted to mention for the new supervisors, the reason that we do this is in our accounting system, grants that cross years don't automatically come forward. So we have to go through this one extra step each year to bring the unspent balances forward in the accounting system. Just wanted to kind of let you know why you're seeing that resolution. It's that way to carry the monies forward because the system doesn't automatically do that.
Thanks, Al.
The second one that we'd like to carry forward relates to our early intervention administration grant. It covers a part of the administrative expenses related to early intervention. The amount for that is $5,669. So just looking for a request to carry that forward.
By Scott. Second by Ms. Mumbly. Any discussion? All in favor?
Aye.
And then the third one is not related to a grant, and it has not been in our budget previously. It's related to the Jewel settlement funds. We were awarded a total of $419,833 for the New York State Jewel settlement. That was through the Attorney General's office. And we'd like to request, the county at this point, it's gonna come to us through 2030. There's gonna be an amount each year. The amount we received so far is $157,437, and that was for the first 3 years of the funding. And we did receive that in 2025. The county received that in 2025. What I'd like to request at this point is to have those funds, the $157,437 added to our 2026 budget, so we can move forward with spending that money. We will receive another $52,479. If it's timely, we would receive it in June of 2026, and we'll continue to receive that $52,000 through 2030. Totaling the $419,000 that we'll receive. So I'm looking for a resolution. What we would use the funds for is evidence-based public health to prevent vaping for youth and young adults. There's a very specific criteria that we have to use it for. It is 100% restricted. So just looking for money, just looking for a resolution to pull that money into our public health budget so we could move forward with those projects.
Move it, finance. Scott made the motion, Sam seconded it. Any questions?
Al, if, I mean, are you good with that, with the restrictions, or we don't have a choice?
Yep, we don't have a choice. Yeah.
All in favor?
Aye.
I just have one quick question. So is Juul, is that the name of a vapor or a vapor?
That's the name of a vaping company.
Gotcha, okay,
It's a lot like the opioid settlement, Mr. Hall, but for vaping.
gotcha. Thank you.
Thank you. The second agenda item that I have is, we did have a student reach out to us, requesting to do an internship, with public health. She is a resident of Washington County. It's Megan McNeil, and she is completing her BSN at SUNY Polytechnic Institute. So she will be with us, throughout the spring semester. So just looking for permission to, have her join us for an internship, and it's unpaid internship.
Got moved.
She's unpaid?
Unpaid is good, yeah.
Any questions? All in favor, aye?
Aye.
Oh,
Thank you. And then just a few things under program updates. As I'm sure you're all aware, we have moved over to Burgoyne. I invite all of you to stop in and see us. It's a beautiful space. We're very happy with it. The other county departments were amazing with helping us move buildings and grounds. They moved us in all kinds of weather, and they were wonderful. Along with IT and safety officers and public safety, they got us all kind of set up with our alarm systems and things like that. So everybody's been great with helping us move, and we're getting settled. And we're really happy with the space. So it's very much appreciated. And the other thing I have, I just want to remind everyone that we do have Winterfest coming up. It's down at Lake Lauderdale. We do it in conjunction with a couple other departments, including the Youth Bureau. It's on February 7th from 10 to 2. And it looks like we're going to have some good weather for it. So we're hoping for a nice, sunny, somewhat warm day.
the ice will be thick.
It should be. Yeah. And that's all I have. Any other questions for me?
Any other questions?
No? Okay,
Thank you very much.
thank you.
Does anybody have any other? I have a couple others. Dwayne isn't here, so I won't steal his thunder. He'll have the exact numbers, but he did tell a few of us the other day that our end of the year housing people we house total, and that was one of our contentious costs as we were doing budget system, is down roughly 60% from the previous year, just in the 3 months. Not because we're kicking people out on the street, but because they're looking at better ways to move people and house them. And so, we're never gonna get to zero, but if we can stay down and hold these because we're always gonna have to be housing somebody. This will be huge. It's a good step forward. One of the other things that he brought up to me is that, especially down in the front where people go in, there's been a tremendous amount of disrespect and abuse of the people working the counters there. And that's why we have a sheriff that sits down there for one of the reasons. And he said that recently one that's been an ongoing problem person really started to raise heck, and he had the sheriff arrest that person and take him out. They were back the next week for their, trying to get their money. They were very disrespectful. They were escorted out. And now that person is being a whole lot calmer and more compliant, and he's trying to get through to the people down there that, we're helping you, you need to be respectful or we don't have to serve you. So it's done a lot of morale for the people down there, and that's another good step forward. So there's things under motion. Now, he has invited this committee, and we couldn't do it because, of course, he isn't here this week, for a quick tour after one of our, like maybe next month, down around through there to meet some people. I also had started this morning, think that it's a good idea to get some people from the different divisions down there to talk to us on what they do, because I'll admit, and I've been on this committee years ago, I don't understand what all goes down on there. And how can we help save money or do a program better if we don't understand what goes on, what all the things are down there? So I'd like to move forward with that. And one of the things that was brought up during budget that we are looking into closer and maybe set some policies. We talked about, should we require drug tests? We're allowed to do that. If you don't pass the drug test, we have to serve you. And one of the concerns is the cost. If somebody does go positive, and I'm not saying we need to drug test everybody, maybe we do random, whatever, that's to be decided, but if they're positive, we're supposed to help them. Well, the treasurer, and that costs money. The treasurer reminded us that there are state funded programs right here in town that we can have these people go to. So if we do some drug testing, one, it'll push some people maybe to help them and get their lives straightened out, move forward, get off the system. And if they test positive and they don't want to do the program, well, maybe we don't have to give them money either. So those are things we all need to look at, set some policies, try to help some people better themselves. There's other things that we need to understand. I've been told that we pay quite a lot to transport people around. We have cars that we buy for DSS. Maybe it's cheaper for us to hire somebody to move people around than it is to hire ride services. There's all these kinds of things we need to look at. And Becky, we're gonna drag you into this because we don't understand where the money always moves down there. We just see a generalization, and we may ask in the future for brief overviews of your different departments, your money in and out and state stuff, so that, something is getting really climbing or dropping. Why is that? How can we help it? How can we do the programs better? It was always in the past, well, it's up 100,000, well, that's okay, 50,000 is covered by the state. Well, it's still 50,000 that we're kicking in there too, so we need to know these things, and maybe some monthly reports coming to this committee or the audit committee or something. So these are all things I'd like to look at going forward down the road here, see if we can make this a more efficient, cost-effective system, help the people that need to be helped. So other than that, Mr. James.
Just agree to emphasize what one thing you said, if you guys, if there's anybody here that hasn't been down for a tour through DSS, go. It's really, pretty eye-opening. You guys can really come out of there with much better understanding. The tour you around, you look at all the different units, talk to people, it's pretty impressive.
Anybody have anything else? We're adjourned. Thank you.